health officials this morning are reporting the first coronavirus death outside of China. A man from Wuhan, China, has died in the Philippines. In response, the Philippines has banned travelers from China.
A 44-year-old Chinese man from Wuhan dies of the virus in the Philippines. And then by February the 4th, a second death outside the Chinese mainland was confirmed.
The year 2020 has stretched humanity from all angles. People are scared. People are suffering. Businesses are failing. The economies have collapsed. And nature is at war. We are in a time that forces us to fail, and yet we're still here. We wake up every morning to try again because the solidarity and triumph of the human spirit is more infectious than any virus out there. With the spread of the coronavirus across Lanao del Norte, our government stood ready to act in providing protection and economic support. Our government scaled up right away to meet the urgent needs of the province, expanding testing, establishing facilities, supporting our frontliners, and ensuring adequate supplies with full respect for human rights and without stigma.
Well, the first thing that we did was we had a workshop to establish the objectives that we want to do, and one of those is strengthening our borders by putting up the quarantine checkpoints in different borders. We work with the local government units in monitoring its municipalities and barangays, and putting up isolation facilities. So the first isolation facility that we put up was the old Kapatagan Hospital, where we brought our COVID positive patients. With the help of the Bayanihan Act, we were able to establish additional isolation facilities. We have identified our Kulambugan Provincial Hospital as our COVID hospital, positive. So those being tested positive are brought to Kulambugan Hospital. We have Kapatagan Provincial Hospital also, which is our COVID hospital, the old Kapatagan. We have the Mindanao Civic Center, which we at the very start is one of our isolation facilities, and if I'm not mistaken, we have almost 100 bed capacity there for IgG positive. One of the health protocols that we really stick on is not to send positive patients on home quarantine. Even rapid test positive IgM positive patients were not sent home. We put them in the MIUs, the municipal isolation units, and the BIUs. So partly I should say na sa pagtinabangay sa kada munisipyo o sa provincial government, medyo napugna na mo ang spread sa COVID here in Lanao del Norte. At the very start, when the governor and the congressman look into what should be the best thing that we'll do, for the sake of this COVID pandemic, they decided to invest on laboratory, since we're having problem with sending our specimens to other places just to be tested, and we have to wait for a long period of time to know the results. So they decided to look into how we can put up this laboratory for PCR machine. And now, after being able to invest on it, so we are almost ready to open it up. The official dam of Lanao del Norte is going to give to the people of Lanao del Norte. It is our dream at the start to have our own PCR laboratory, and it's all coming true. I should say we were able to contain this with the help of the people. Their trust to the officials of the province of Lanao del Norte, the cooperation of the people is one of the most important thing that help us contain this pandemic. As incident commander of the Lanao del Norte Incident Management Team, I would like to thank the people of Lanao del Norte for trusting the governance of Governor Anging, Congressman Khalid, and Congressman Bobby, together with the elected officials, the Sangguniang Panalawigan. Thank you for trusting them, and we look forward for your cooperation, observing the health protocols that we want to implement. This is not for us only, but for all of us, the people of Lanao del Norte. And maybe one thing that we could do to help this pandemic is, as much as possible, if you don't have any important matters to go to outside the province of Lanao del Norte, stay home and stay safe.
Like them, it is also within our hands to fight the virus. Together, we can prevent infections and save lives by breaking the chains of transmission.